Okay, so today we're going to be drawing the ACA. So many of you guys could be watching for different reasons. You could be a high school student just curious about current events, or you can even be a college student or a college graduate, or just anybody who's just curious. But you guys are all here because you want to learn about the ACA Basics and what it is. So you guys may be a little confused because in the news there have been a lot of arguments for and against it. The Affordable Care Act is also known as Obamacare or the ACA. So what you need to know is that it was introduced into law in 2010 by Barack Obama. It's all about insurance. The purpose behind it is that they wanted to increase the total number of Americans who had insurance. They wanted to target a specific class, and more specifically, the lower class. They wanted to make it affordable so that they can have insurance too. It was a success. The number of people who were insured did increase. A study done showed that compared to 2012, the number of people who are uninsured dropped by at least 9%, and also introduced the 10 essential benefits. So some background vocabulary you need to know is that premiums are the amount of money that you have to pay in order to have insurance per month. Now, deductible is a certain amount of money that you have to spend before your coverage kicks in. So there's 4 plans offered by the ACA. And what you need to know is that the higher the bar, the more coverage you get, but also the higher premiums you have to pay per month. So the higher the coverage or the higher the bar costs more per month. But a lot of people pick the lowest one because it does cost less per month. So lower the premium equals higher the deductible, which is not a good thing. Because that means everybody at the lower level does get insurance, but they pay more. So like I said, lower premiums equals higher deductibles and vice versa. So someone with the higher plans, they pay a lot per month, but have to spend a little to get through their deductible. And the silver and bronze have to spend a little per month, but spend a lot to get their deductible. It seems a little ironic because it's kind of hurting the people it's supposed to protect. You might be a little confused why someone in the lower class has to pay more money before they get coverage. Anyways, all their money is going towards having insurance. So how do they afford medical expenses if they can't even reach their deductible? So someone in the lower class, they pay a lot of money before they reach their deductible. Someone in the upper class pays a lot per month and gets their coverage faster. So not only that, but deductibles have increased. More specifically for individuals, it's increased $1,000, and for families, it's pretty much doubled. So someone in the lower class who picked a lower plan does have insurance, does get lower premiums, but has higher deductibles, lower coverage, and also deductibles are rising. And this is all just so they can say that they do have insurance. So this is leaving a lot of people in the lower and middle classes with less money because they can't spend all of their money on medical expenses themselves. So a lot of their bank accounts are going empty. So what happens if someone gets sick? They're already in the lower class, they don't have a lot of money, they're already spending money on premiums, and they have to spend a lot more money than the upper class in order to reach their deductible. So what do? All of their money is going to their insurance. They're trying to reach their deductible, but they're in the lower class. So a lot of people turn to skipping treatments, and about 30% did in 2014. Skipping treatments, though, ultimately makes it harder to reach your deductible. So a lot of people are angry about this. So insurance is there, but the coverage is decreased and you can't even reach your deductible. So what's the point? And it's hurting the class it was supposed to help, isn't it? So if you're wealthy, you're happy. If you're poor, you're not, and it's not fair. So a lot of people want the ACA to be trashed. And current President Donald Trump agrees and believes it should be repealed. So in order to repeal it, you have to replace it. So what's he going to replace it with? Well, something called the Patient's Choice Act. The Patient's Choice Act was introduced by Paul Ryan. And there's a lot of promises within this bill. It wants to return power back to the people and doctors so that they can choose where to go to for services. It promises not to raise taxes and also guarantees that no increase in government spending. So with the ACA in the trash, Paul Ryan's bill should follow. And this is why. Under the bill, the CBO found that covered people will decrease. 14 million fewer people in 1 year and 24 million people in 10 years will not have insurance. He also plans on cutting Medicaid or Medicare. Medicare is essential because if you're not an elder person and you didn't save a lot, or you've been in the lower class and were unable to save a lot of money, your bank account is not going to have a lot. It's going to have cobwebs and it's going to be nasty because they're retired. So how are they supposed to pay? So you must be wealthy and middle-aged and healthy if you're going to survive either of the systems. So this made a lot of people angry. So a couple things you can do are contact and inform your local congressman, advocate against the ACA and Patients Care Act. Also, encourage the creation of a bill that is affordable and provides adequate coverage. That's it, folks. The end.